Well, we saw two well-conducted, essentially negative randomized trials of introducing a new agent to chemotherapy in advanced pancreatic cancer. One was in first-line treatment, in which patients got standard gemcitabine plus nab-paclitaxel, and these patients were actually selected to show overexpression of the target. They had to have overexpression of hyaluronic acid in the tumor, so it was a biomarker-selected population. And patients were randomized to chemotherapy alone versus treatment with chemotherapy plus the pegylated hyaluronidase. And essentially a flatly negative study. There was no difference in any outcome. Hazard ratios were 1 across the board. No improvement in overall survival, progression-free survival, no significant improvement in response rate. More toxicity, but manageable. So a disappointing study, but we had gotten an inkling of this when earlier data looking at adding this drug to FOLFIRINOX actually causes survival detriment compared to FOLFIRINOX alone. So despite the anticipation that this might be a positive trial based on phase 2 data, even a biomarker selected population was negative. The other trial, again, there was a good signal from the phase 2 study of pegylated IL-10 added to chemotherapy. This was a second-line trial. So patients received FOLFOX after previous gemcitabine-based chemotherapy, and also looking at overall survival, FOLFOX alone with or without pegylated IL-10, and was a negative trial. Wasn't detrimental, but similar to the PEGPH20, all the hazard ratios were 1, no difference in any progression-free or overall survival outcomes. So I think we have to look at other targets.